Good morning. Today we're going to be doing trach care. This is just taking care of the trach that the doctor has inserted. The very first thing you need to make sure is that you have the new inner cannula that matches the cannula the patient has had, because you do not want to have the wrong size here and try to insert this into your patient. All the supplies that you will need is listed on your sheet, but I will go over those briefly with you. You'll need a Trach Care kit. You will need your inner cannula that's the same size as your patient's. You will need a drain sponge. You will need normal saline, peroxide, clean gloves, sterile gloves, because this is a sterile procedure, and then you will need your Q-tips and some type of bio bag. The first thing that I have found, nursing has to learn to do procedures on their own and keep it sterile. So what I want you to do is get a piece of long tape, tape it on, or just kind of place it on your table. Take your Q-tips, place those on the sticky part of your tape. So you can do this procedure right by yourself. Then take this and tape it to your table. Now, place on your clean gloves to remove your old dressing. Now, while you're removing your old dressing, make sure you hold this trach, because you don't want it to irritate the patient. So gently just remove the old dressing while you're holding the trach. When you remove the old dressing, turn it upside down so you can actually look at the drainage, see what color it is there any foul odor, and then you need to document this in your nurse's notes. Then remove your gloves as you were taught without getting the drainage on you. Throw it in your bio bag and then go wash your hands. All right, now we got to open all our sterile supplies. So what I want you to do is I want you to open your Q-tips from the back so you will not contaminate them. Your Q-tips are open. Then you'll need to open your trach kit. Now, I'm going to pick this up so I can show you on the inside. There are two slots. One is, the front slot is going to be for your peroxide, and the back slot is going to be for your normal saline. Now, what I want you to do is just touch the lip of the inner tray. Just slide it off to the side, because you will not be using any of that. Then take your, it's like a little cloth, take this little cloth out, and you can see there's a shiny side and there's a dull side. Shiny goes to your patient, because if you spill anything on them, it will not soak through your gown. All right, then take your normal saline, label to palm, lip it, and remember to lip the way that you're going to pour it. Pour a little bit into your back tray. Then take your peroxide, label to palm, lip it, pour a little bit in the front tray. Then make sure that you date, time, and initial your bottles so they'll know when they were open. Then take your inner cannula, open it. Then take your drain sponge, open it also. Then you've got your sterile gloves. They're going to apply. package of your sterile gloves go over your open supplies that you're going to be using. Apply your sterile gloves the way you were taught. Okay, gloves are on. Now, we opened our Q-tips from the back to the front, but now since we are sterile, you want to get your Q-tips from the front to the back so you will not contaminate them. So take 2 of these, place in your normal saline, take 2 more, place in your normal saline, take the next 2, place in your peroxide, and then take the last 2 and place in your peroxide. Now be careful with your left hand. I am right-handed, so I will be using my right hand to clean with, but you do not want to touch the bed or your patient because this hand will be contaminated then. Take your peroxide, and what you want to do is clean real good your flange on one side. Get rid of it. Take the peroxide again, the opposite flange, clean it real good because this gets real dirty. Throw it away, but make sure you keep your hands above your waist. Take your third Q-tip, go up under to where the actual trach goes into the skin, clean it real good, get all that crust off. Get your last Q-tip out of the peroxide, go in the top, clean it real good, throw it away. Now you want to repeat the steps with your normal saline because peroxide is a drying agent and it will dry the skin out. Now you want to come back and clean all that peroxide off. Just repeat yourself. Your second one, the opposite side flange. Your third one, up under, make sure all that peroxide comes off. Clean it with your normal saline. Get your last one, go to the top. Clean it real good. Now, go ahead and pick up your sterile inner cannula, and with your non-dominant hand, take out this old cannula, place your new inner cannula in there, and clamp it on, and then this one goes in the trash. Now, your sterile procedure is over. So now we need to take our drain sponge, and you can actually use your forceps that are in your little package that you removed from your kit. What we're going to have to do is slide this under the trach itself. So this is like a drain sponge to catch all that drainage. Careful not wiggle it too much. Now that is Trach Care.